Morning stiffness every day? It may be an early sign of arthritis. Namaskar. Do your hands or joints feel stiff every morning? Morning stiffness commonly affects the hands, wrists, lower back, knees, and other joints. Your fingers may feel swollen, tight, and difficult to bend or straighten. If the stiffness lasts only for a few minutes after walking, it is more commonly linked to osteoarthritis. However, if it lasts longer than 60 minutes, it may be a sign of an inflammatory condition such as rheumatoid arthritis, psoriatic arthritis, or ankylosing spondylitis. Persistent morning stiffness should be evaluated by a qualified healthcare professional for an accurate diagnosis and appropriate treatment. I am Dr. Smita Naram, co-founder of Ayushakti, and for over 38 years, we have helped 1.8 million plus people from 108 countries to improve their well-being through 150 practitioners that we have throughout the world, combining traditional therapies, nutrition, lifestyle guidance, and authentic herbal support rooted in 2,500 years of Ayurvedic Siddha wisdom. At 88, my mother is still walking comfortably after years of morning stiffness. I still remember watching my mother pause at the bottom of the stairs before taking her first step. It wasn't the staircase that worried her, it was the discomfort with every step. From the age of 67, she experienced persistent knee pain and morning stiffness, which was increasing for last 5 years. Walking, climbing stairs, and daily activities became increasingly difficult. Like many people, she believed it was simply a part of aging and relied on temporary relief by taking pain medication. That's when, finally, we decided to create a long-lasting building joints health. She followed Ayushakti's Arthritis program, including personalized herbal support, dietary changes, lifestyle guidance, and traditional Ayurvedic therapies. Within 3 months, she experienced about 60% improvement in her comfort and mobility. And the great part was that she didn't need to take any painkillers. Over the following years, her mobility improved further by following and completing the Arthritis program for 1.5 years, taking diet and herbal supplements constantly, allowing her to return to an active lifestyle. Today, at 88, she walks comfortably, climbs stairs with ease, she plays Garba and continues to stay active. This is just one of the 300,000, or in India we call it 3 lakhs individuals who have received personalized Ayurvedic care through Ayushakti over past 38 years. This is an individual experience and results can vary from person to person. Please note, clinical research in a peer-reviewed American-based medical journal, a double-blind randomized placebo-controlled study evaluated the Ayushakti's Arthritis program in people with chronic joint discomfort. After 3 months, the participants in Ayushakti group experienced significant improvement, up to 70% improvement in joint pain, stiffness, and physical functional capacity compared with the placebo group. 90% people got rid of their dependency on anti-inflammatory pain medications. 70% people experienced long 8 hours sleep with improved daily activities, including walking from 5 minutes capacity to 30 minutes, standing for 5 minutes to 30 minutes, and the program was found absolutely safe as per the study. These findings are based on a clinical study and may not reflect every individual's experience. But this study had at least 80 people in the group. Results vary and the program should not replace medical advice or prescribed treatments. Start today immediately. Follow the diet of choosing warm, freshly cooked meals with cooked vegetables, easy to digest, dal, rice, khichdi, millet based chapatis or bread, gluten-free items, calcium-rich foods such as ragi, Indian fox millet, sesame seeds, flax seeds, pumpkin, almond, spinach, these are all very rich in calcium. When you take natural calciums, it is directly converted into the bones in a better way rather than chemical calciums. Avoid refined sugars completely, excessive wheat, fermented food, raw salads, ice cold foods, drinks, and highly processed foods should be avoided. Traditional home remedy, which I have tried on thousands of people in last 38 years, and definitely if you have an early stage of arthritis, you will feel the relief with this in back pain, neck pain, frozen shoulder or joints pain. Mix 1 teaspoon each of turmeric, coriander, fenugreek powder with half a teaspoon of dry ginger, half teaspoon of garlic paste, quarter teaspoon ajwain in warm water at bedtime. 1 teaspoon castor oil with hot water is another traditional Ayurvedic practice. Traditional remedies should be used only under the guidance of qualified Ayushakti practitioners. Before you accept that joint pain is just part of aging, ask yourself, what if taking care of your joints today could help you stay active for years to come? Follow Ayushakti for simple Ayurvedic tips to support your and your family's health naturally.